Welcome back, everybody, and thank you. We've just noticed that Lubna and I have subconsciously chosen green as our theme, and our next speaker as well has also got green, so we are leading at the green transition for health, even starting with we're walking the talk, we're wearing the talk. So I promised before the break that we would hear from Lubna Bouafra, who is the founder and CEO of Okra Technologies, which is a leading award-winning artificial intelligence analytics company in the area of life sciences. And for Friends of Europe, she's a member of our European Young Leaders Network. I've had the pleasure of talking to Lubna and hearing her speak many times over the past years, and she has a truly visionary, clear sense of how AI is a tool that supports us in change rather than what perhaps people fear, which is that it would control. And we invited Lubna to come in and set out a vision really about how we put the human in the center of AI for health. So Lubna, the floor is yours.
Thank you, Tamsin. Hi everyone. It's a pleasure to be here with you today. So we heard in the first panel, and please, if you can share my slides, I think that's waiting for the team to get it. Great. So we've heard in the first session how we need to put the patients in the center, from their experience in the healthcare system, from their opinion in the ideation, in the design phases of any product into healthcare. What I'm going to share with you today, how we are bringing the patients in the center through their data. So if you look to our world today, I was born in 1983. Back then, the world population was about 4.7 billion people. So today, last week or 2 weeks ago, we reached 8 billion people on this planet. All of these people, all of us, our data is already used. We've heard from Andres, there is a consumer in us, there is a patient in us, and there is a citizen in us. Both the consumer and the citizens, our data is streaming everywhere. When we buy things, when we visit shops, everywhere we go, when we use transport. But the patients in us, so our data is used only when it's necessary. So how can we change that? Since 1983, many things changed in our world, but healthcare didn't change that much in terms of workflow. We still wait for people to get sick to help them. And today, the healthcare sector, after the pandemic, we are facing great challenges in terms of capacity, in terms of dealing. How are we going to keep 10 billion people healthy by 2050? And the commitment we have on CO2 with getting zero carbon. So how are we going to get all these goals? How can AI and data help us get there? So Outliers is the story of healthcare. One of the main barriers for healthcare that we are seeing people as averages is a mathematical theorem called the central limit theorem. There is, of course, the bureaucracy that dominates the healthcare, but there is one formula in mathematics which I love so much, that it tells if we take a few samples that are randomized and biased, we can fit in a nice bell curve, a Gaussian distribution, and generalize the results, which is fantastic when we can apply that. But in healthcare, we can never get to that level of uncorrelation. Not only that all our organs are correlated, but also we are sharing the same environment in terms of pollution, societal impact. All of that makes us very correlated human beings. So to apply the central limit theorem, to apply that we can generalize treatments across population, and the gold standards for validating treatments is clinical trials, is applying this theorem to validate treatments and assume it works for everyone. It's not realistic. We've done it and we keep doing it. We keep calling it gold standards, but today we have the technology that is truly gold standard. If we look to this distribution, the tiles of it is the majority. Most likely you and me will be in those tiles of distribution, which means it won't work for us. So how can we move to the tiles of the distribution where the majority of us lie? And that is the technology of AI. AI leverages these algorithms to bring together different data sets, from health data to environmental data to societal data all together to predict what is the best outcome, what is the best treatment for these patients. Taking also lifestyle data, which is very important, how mobile this person, in which environment, and how can we get the better treatment. And that's where we need to move. So when we talk about AI, the father of AI is Alan Turing. AI doesn't need to pass the Turing test for healthcare, which means it doesn't need to outperform humans. It's taken a different role than humans here. So AI is very good in analyzing a huge amount of data historically to come up with a prediction. It's a very good tool to predict. It's a very good tool in an industry that is evidence-based, which means in healthcare, we use the past to predict what is the best treatment and the best action for this patient. So in healthcare, AI doesn't need to pass the Turing test. AI is taking a different role. It's similar to the aerospace industry. Airplanes didn't need to fly like birds. It had to be designed to respect the aerodynamics laws to fly under this engineering condition. So I believe we should treat AI like engineering, to deploy AI systems where there is the need for this, remembering all the history, identifying the best treatment possible, identifying to which course we need to follow, rather than try to mimic what humans already do. So which tasks do we see in healthcare? So we already see huge tasks that are ready and ripe for automation. Think about patient triage. So we can deploy AI solution to early in the process triage patients to different scores, to serious cases, routine cases, to free up the time for the medical teams, from nurses to doctors, to focus on what really matters. We can deploy AI in processing low-level data, which is around imaging, around scans, where there is high capability to be able to detect tumors and to detect nodules very, very accurately than humans. So there is huge potential to include these solutions across the point of care and to have a central way that can pass and continuous testing of those systems and the accuracy of those systems and bring in the speed and the accuracy into our healthcare system. We already have, in research, proved that AI achieved high level of accuracy to be deployed in the clinical settings, in dermatology, in ophthalmology, in radiology, in so many applications. But why is it not there? So the barriers are not the tech or the data, even in this case, the barrier is to get it to the clinical practice. So why the time is now? We are all at inflection point, not just in healthcare. In every industry, we are at this inflection point. We just passed through the world's largest pandemic and now entered into a war, and all the world changed overnight. And in healthcare, what did it mean for us? We see that we could validate the vaccines within 10 months instead of 10 years. We could bring the speed into the clinical trial process. We could bring the speed of bringing these new treatments faster to patients. And we are at this point where we see the capacity of our healthcare system is getting under pressure. So the time is now to really leverage the data and to adopt, to bring not only the safety and the effectiveness of treatments, but also the efficiency. And that is the moment is now, and therefore we need to make that decision and to make that transition faster. We discussed yesterday, what if we don't? If we don't, we know what is going to happen. If we don't, we know that there are already big platforms reaching very large population of consumers. They're not going to go to the patient. They're going to go to the consumer who wants a fast service, speedy service. They want not to waste time waiting for a GP appointment. They want just to be alerted and treated like a client. So adopting those services when they are available from a big tech platform will be the easy option for this new generation. So we really need, if we want to keep protecting our healthcare system as we know it, we need to make that transition to start leveraging the data, from health data, from environmental, from societal, to predict and to prevent and to support the patient and not the consumer. So let's imagine, what health do we want by 2050, when the population is about 10 billion people? We want a healthcare system that from birth, childbirth, we already have a data to start with, predicting the risk for potential rare diseases prior to birth, already preparing the parents to how to care for this child. And during birth, already we start scanning from genomic data to all scans to be predicting. And as we move along, our data is speaking for our needs as patients. It's driving our healthcare system. Imagine this data-driven system, that the fuel of this system is data streaming from every one of us, that all of our data is helping millions of other patients because we have similarities in that aspect of our human body. So when in one of my talks, one of the people in the audience asked me, well, I'd like to be part of it, but can I opt out from sharing my data? So just imagine being part of this system. You are using everyone's data to get a better treatment for yourself and to prevent yourself from getting sick, and then you decide to not share your data. How ethical is that? It's just like wanting to get an organ from other donors, but you don't want to be a donor yourself. I believe ethics is a double-edged sword. It's not only ethics towards the technology and towards our rights as citizens, but also ethics around how we participate in this era of the fourth industrial revolution, where the fuel of the economy, to drive it to be outcome-driven, is our data themselves. Why we are sharing our data with all these entertainment platforms, but when it comes to health, it becomes a taboo, and it's my data. So I think we really have to rethink the way we see this. And we have to position it differently from patients to consumer to citizen, especially when our competitiveness and our health standards, healthcare system standards, will be at the level of the quality of the data we train it with. So data is the new fuel. There was some discussion yesterday that whether that's the right thing to say, whether data is the new currency. Well, in this shift from an economy that was volume-driven, with selling more products as a volume, to an economy that is outcome-driven, we do need data. Without data, we cannot make that shift. Not only we have to make it, because of the world population is plateauing by 2100, that we will not have the growth, the exponential growth of the population. So every economy is moving from a volume-based to outcome-based to make more profit. But in this specific industry, we are evidence-driven. So we should be outcome-driven from the beginning. But because of the history, we have been focused on this specialization or clinical-driven healthcare. At this time, in order to move to the outcome-driven healthcare, we need that data to be able to predict what works, what doesn't work, what is the risk. Without it, we will still be paying for the pill instead of getting better. And that is the shift that we need to move, and that's why data is the fuel of this transition. So data sharing, as I mentioned, is a key element for this. And in order for our healthcare system to be 100% holistic and to be patient-focused and patient-centric, not only from an experience level as patient, but also from the data level, from the environment level, from the societal level, we need all this data to be deployed, to be supporting our healthcare system, the different patients' pathways, the different prescription of treatments, and also marrying together the outcomes and the costs, that we can predict what is our budgets here, what treatments can we afford, and how to drive it together. And not only that, we not only have health outcomes, we also have carbon outcomes and societal outcomes. We can bring this together. At OKRA, for example, we are evaluating the different treatments, not only on their clinical outcomes, but also treatments that require a visit to hospital, they have higher carbon footprint. So we will need to manage multiple outcomes and orchestrate the decision based on that. And that is the role of our governments and our healthcare system. How can we reflect that in the way we interact with patients? That brings me to the ambition on the European healthcare data space. We have, as entrepreneur and AI scientists, I have big hope that the European data space will be the catalyst to move to this data-driven healthcare system. When I a few years back, when I started exploring, and I was part of the high-level expert group looking into the European health data space, I realized it was a summary. It was aggregated summary. We cannot use a summary to train AI. We need granular data on a patient level, standardized, and at the right level of granularity to be able to deploy AI systems to predict outcomes and to be able to productize it in a proper environment. So when I hear the discussions about the European health data space, I am very excited, and I'm thinking there is a huge opportunity if we get the engineering parameters right, the right granularity levels, the right covariates, because we also saw the experience in the US because the data there is already collected. Sometimes key parameters, for example, for oncology, like the ECOG, they are not collected properly. So how can we make sure that the right variables are in there? We have the opportunity to build it here. And last but not least, it needs to be shared with the right stakeholders. At the moment, I only hear around healthcare providers and academia. Well, we know what is the incentives there. Academia is incentivized to publish results in good journals. That doesn't mean it can get it to the level of productization and level of deployment and industrializations to serve the patients at the point of care. So in order to do that, we have to rethink. And we can use positive discrimination, it's been said yesterday, to choose the right companies that will help this transition to data-driven healthcare systems across our member states. So I will say, just like my previous speakers, that I'm very optimistic about the course and the decisions that we are making. We are at this inflection point, and we have good values. So the ingredients for the good AI is not only the data, it's also the outcomes. We know from the different continents in the world, Europe is focused on the right values for citizens and for patients, and we know other continents are more around driving the competitiveness. We see how AI is used to drive more ads and to sell more products. We have here the advantage that we can define the right outcomes for our AI to drive the patient outcomes to drive sustainable outcomes combined together with patients' outcomes. So we have a huge opportunity because we can control those outcomes where we train our AI from. What we need is really the data and to the right granularity level and to the right stakeholders to get to that future of data-driven healthcare systems that prevent people from getting sick in the first place and help us get into integrated and standardized healthcare system across Europe. Whether you are moving from one member state or another, your data is speaking for you and is helping other patients to get better. Thank you.
Thank you very much, Lubna. That was really fantastic. Gave us an overview of some of your hopes for the European health data space and some of the challenges. We're very tight on time, so I don't think we'll have a chance to take any public questions, but I know you're going to stay with us this morning, and Lubna is in a lovely green dress. It's easy to find her. Please go to her and ask questions, because she's really at the forefront of how do we define AI to serve health outcomes rather than to sell products or something else. So she's got a very clear vision of how we put the human in the center of AI. So thank you very much to Lubna.